Let's see. Okay, can you see the rotator cuff and shoulder pain workshop on the screen?
Yep.
Okay. So let's see what time are we at here. I grab my phone so I can see my time on here.
12:01.
All right, well, we'll go ahead and get started then. So like you see there, this is a workshop about rotator cuff problems and shoulder pain problems, and goal is kind of teach people a little bit about what's going on with shoulder issues and how what things can be done to try to help you get back to normal without unnecessary medications, injections, surgery. Sometimes they're necessary, sometimes not. And sometimes you can have surgery and you still need some extra help to get it back to functioning at full-fledged. So feel free, since there's only a couple people on here, I would say feel free to go ahead and ask questions as we go. Normally when we have a little bit larger group, we'll try to hold questions till the end, but you can ask as we're going if you'd like. And you can also put stuff down in the chat and Noah can answer those in the chat. You might even just put down maybe in the chat your first name and maybe just something that's going on with your shoulder, like what you've got going on, so that you may be able to answer some questions for you as that's going as well. So we're Core Rehab, and I'm Steve Bjorn, and the other gentleman there is my business partner, Noah Burton. And I'm a doctor of physical therapy, been doing this for over 20 years now, and have a lot of experience in dealing with this, kind of been specializing in shoulder for a long time. I tore my labrum in my left shoulder when I was in high school, and about 16 or so, and didn't have it repaired until I was in my 30s. Was able to keep it under control and doing well for a couple decades, and then got to the point where I was going to have to quit playing basketball or have my labrum fixed. And so I had my labrum fixed so I could keep playing basketball again. So been through surgery and treated literally thousands of people that have been either through surgery or just had injuries or just chronic overuse or bad positioning that's caused them trouble. So first of all, just a little bit of information about what the rotator cuff is. So the rotator cuff is a group of 4 muscles. So sometimes people will think that rotator cuff is just a particular muscle, or sometimes they'll think it's just a tendon or a ligament or something. So it's a group of 4 muscles. And it's usually where those muscles turn into tendons to wrap around the head of the humerus, where people end up having problems with it. So the head of your humerus is like a ball, and the 4 different rotator cuff muscles, you got 1 in the front and 1 on the top and 2 in the back, and they wrap around that ball and try to help support it and hold it in there and create the mechanics and the movement that's supposed to happen in our shoulder. So our shoulder is the most mobile joint in the body. No other joint can go around in a big circle like that. And so by being that mobile, we give up a little bit of stability. And so the labrum and also the rotator cuff are things that help provide stability. When your rotator cuff works like it's supposed to, it helps initiate the movement of the arm and helps stabilize the head of the humerus into the socket like it's supposed to, because that socket, that little place where the head of the humerus sits, is really, really small compared to that bone. So it's called your glenoid fossa. You don't have to know the technical terms for everything, but the point is that head of the humerus sitting on that little glenoid fossa is comparable to like a golf ball sitting on a golf tee. So it's much bigger than the surface that it moves on. And so if the labrum's not doing its job, and the labrum is a cartilage that wraps around the entire joint to help stabilize it and to hold it in place. And then that rotator cuff wraps around that. And when it contracts as a group, it pulls it in together. When you contract them individually, like one helps you come up, one helps you rotate out, or 2 help you rotate out, 1 helps you rotate in. And so individually contractions, they move your arms in specific ways, but as a group, they contract, they help the shoulder glide and move the way it's supposed to and help stabilize it. And there's really multiple areas that work together. Anybody that's looking at your shoulder, just at your shoulder joint, we call that the glenohumeral joint, right there at that one specific spot where the arm bone meets your shoulder blade, is missing a lot, because the vast majority of the time, there's a lot going on with the neck, your collarbone, your shoulder blade, your rib cage, even your thoracic spine. All of that really has to work together in order for your shoulder to be functioning correctly. So sometimes when people have been through treatment or they've been through surgery and they're still not getting all the way back to where they need to get to, or they've had an injury and they're not getting all the way back to where they need to get to, or just some overuse from work or from posture, sitting, or some exercise, it's not just the shoulder joint that needs to be looked at and treated. And that's one of the things that we do with the therapy with the difference is address that whole area and the whole body and the whole quadrant to really change the way things are working. Because if you just focus on the shoulder joint, you miss a lot that's going on with the neck, the collarbone, the shoulder blade. All of it has to work as a unit in coordination, or you're not going to have the use and the movement and the reduced pain that you need. So the next slide here is, I kind of went over this a little bit already about that. Together we have over 40 years of experience, and we've done lots and lots of continuing education on techniques that aren't commonly used, from total motion release to trigger point needling to myofascial decompression, a whole bunch of things that are a lot different than what a lot of people will do with just, okay, here's a list. Everybody that has shoulder pain come in, here's a list of band exercises for you to do. But we've gotten a lot more extensive with our manual treatment and with our corrective exercises to specifically figure out what's going on with the neck, the collarbone, the shoulder blade, and all that to change what's happening and how it's functioning. So we're also a certified strength conditioning specialist, which is the certification that your professional and your college strength coaches would have for those sports teams as well. So we progress people back to higher level of function, get them back to doing more athletic things, more workout type of stuff as well. So one of the biggest things that you need to ask yourself to know whether your issues can be improved, resolved, is your pain reproducible? Because if your pain is reproducible, if you can create your pain by doing something, carrying an object, lifting something, reaching up, reaching back, if you getting your shirt on or off, if you can recreate your pain by doing something, then that means that your pain is also reducible, that we can reduce your pain, because that means there's some sort of a mechanical problem. We don't know what it is until we do a good assessment on how you move in general, but it could be the shoulder blade, it could be a weakness, it could be a tightness. Your pecs may be tight and that might be causing your trouble. You may have some issues in your neck with some stiff joints in your neck that are causing your trouble. The ribs might not be moving well. So the good news is that if your pain is reproducible, if you can say, okay, well, if I reach out to the side like this, I reach behind me to get in the back seat of the car, I pull my shirt off, I get that pain, familiar pain again, then that means your pain is reproducible. And if your pain is reproducible, then it's also reducible. We can reduce it with the things that we do to improve the mechanics. So whenever we're talking about somebody having pain, there's always three ways that people will handle their pain or their dysfunction or problem. Say they can't move in a certain way or it hurts to move with something. There's three ways people handle it. They ignore it. This sounds like excuses, like, well, my family has bad shoulders, I have a bad shoulder, it's just the way it is. They maybe try to alter it, and this is taking medications or getting injections that aren't really fixing what's going on, but they're altering it. They're covering it up and hiding it for a short period of time. The analogy I like to use with these things of ignoring it or altering it is like your check engine light comes on in your car. Well, if your check engine light comes on in your car, you can see that light come on and you may just ignore it and just try to not look at it and pretend it doesn't exist. And you may go okay for a while, but eventually what's going to happen? Eventually it's going to end up having a bigger problem. Your engine's going to have something more significant happen to it, and it's going to cost you more and be more of a hassle to fix it in the long run. Altering it would be like putting a piece of black tape over that check engine light so you don't see it every day, or disconnecting the fuse of that check engine light so you don't see it every day. So you don't see it, but it's still, whatever the underlying problem is still there. And then handling it would look like taking it to the mechanic and figuring out what's wrong and why is the check engine light coming on, and actually addressing the specific problem. And so that's what is the most important thing, is kind of figuring out with the movement analysis, well, what's the most specific problem? Because the problem that a lot of people run into is we all have wear and tear. We all have rotator cuff tears, at least partial rotator cuff tears. We all have arthritis. We all have cartilage tears, the degenerative joint disease. We all have that going on. There's been many studies that have been done where they've taken a completely pain-free, healthy population, no movement problems, no pain problems whatsoever. And they've done imaging of them, the x-rays and the MRIs. And when they do that imaging, you see that 70% of people have all of those issues going on when you're over 40. If you're over 50, it goes up to 80%. You're over 60, it goes up to 90%. We all have rotator cuff tears. We all have arthritis. That's normal process of aging. It's like gray hair and wrinkles. We all get it. And so your picture, your MRI or your x-ray, taking a picture of what's it look like inside that joint, has probably looked like that for years, but you don't have pain. And when the pain starts, you don't have a picture because you didn't have pain. So you don't have any picture of it. What does it look like now when I don't have pain? Then your pain starts. You go take a picture and you say, oh, look, you have a small rotator cuff tear. Oh, look, you have a small labral tear. Oh, look, you have some arthritis. That must be your problem. Let's go, address that right off the bat. And the vast majority of the time, that problem was there long before you ever had pain, unless you had a specific injury, like you fell on your arm and you felt it pop and, that tore that rotator cuff at that moment in time. But when it kind of builds up over time, it got worse and worse with lifting. It got worse and worse with sitting at my desk at work. These things, you've had those problems in there for a long time. So when they take the picture and see that picture would look the same before you had pain as it did after you had pain. But there's something else going on. Usually you start getting stiffness in your neck, you start getting loss of movement in your shoulder blade, your thoracic spine doesn't move as well, your pecs are tight, and then it starts to build up, and that underlying arthritis, that partial rotator cuff tear, that little bit of tendonitis that's been there for a long time, it now rears its ugly head and creates more pain now. So what are the most common causes of shoulder pain? We'll go through some of these things. If we're not talking about just purely the arthritis and the rotator cuff tears and tendonitis, labral tears, what causes shoulder pain to kick in and be a big problem? Well, the first thing is neck issues. Sometimes shoulder issues are misdiagnosed and they're coming from the neck. If your neck is real stiff, if say you raise your arm on one side and it's stiff and doesn't move quite as well, it kind of gets stuck and doesn't go, or it's painful when you get up to the top compared to the other side. And say you turn your head to that same side and it doesn't move as well as turning your head to the opposite side, really high chances that there's a neck issue contributing to your shoulder problem, if not the cause of your shoulder problem. So neck mobility causes a lot of problems because it's all interconnected, and there's nerves that come out of your neck that feed the stimulation to your muscles to tell your muscles to contract and to move. And if there's a little impingement on those nerves, or if there's just even a little stiffness in those joints in your neck, then your shoulder's not going to move normal, and you're going to have more and more trouble with it. So common cause that's missed is neck issues. Another really common cause of shoulder pain is what we call impingement. So I like the picture shows here, when you go to raise your arm up, the bone of the end of your arm, that head of the humerus, it's kind of like a ball, will roll up and pinch against what's called your acromion, the top of your shoulder blade. And when it pinches in there, it pinches the bursa and the rotator cuff tendons that come through that space between the head of the humerus and the acromion. That gets pinched in there, you get like this kind of sharp pain that radiates down the side of your arm towards the end of your deltoid here. It'll refer right down the side of the arm. So when you get this pinching here, radiates down, especially when you do movement like up to the side and it's worse in through this area here or back behind you and you get that pinching radiating pain. And that is pretty much always caused by something not moving correctly. There's some mechanical problem. Maybe that your rotator cuff is weak and not pushing the head humerus where it's supposed to go. It might be that your muscles of your shoulder blade are weak and they're not pulling your shoulder blade back and down out of the way, because when you go to raise your arm, your shoulder blade is supposed to move. And if your shoulder blade moves, that clears space and allows it to move better. If the shoulder blade doesn't move the way it's supposed to, it's going to end up pinching in there instead of gliding all the way up. It could be stiffness in your thoracic spine or your pec, but there's a reason why it's pinching and it needs to be addressed, needs to be figured out. Okay, is the collarbone stuck? Is the shoulder blade stuck? Is the rotator cuff weak? What do we need to do to make that shoulder blade move and make that humerus move the way they're supposed to, so we no longer pinch in there? If we just do medications, injections, it'll decrease the pain for a short period of time because it reduces inflammation. But if we don't change the way the shoulder blade and the humerus are moving, then it doesn't fix anything or really change anything. Another super common cause of shoulder pain is postural issues. The way we sit at our desk at work all day long, it develops. I mean, there's been a lot of studies that have shown, and doctors are reporting that sitting is the new smoking. You know, we knew decades ago that smoking was bad for us, and that became something that was a big push to try and get people to stop smoking. And now we sit so much that sitting has become as bad for our health, not just musculoskeletal, like we're talking about, like muscles and joints, but also everything, overweight, cardiovascular problems, circulation issues, causes lots and lots of problems. And so if we're sitting and our shoulders are forward, it creates a bad positioning, and the muscles can't work the way they're supposed to. Get really tight in our pecs, we get really weak in our upper back and our shoulder blade area, and things don't glide the way they're supposed to. Having things in a bad position to start with causes things to not move correctly when you try to move. So a common analogy we'll give people to try to show them what this is like is, if you take your hand, can you see my hand here? You take your hand and you make a real tight fist with your hand in a neutral position compared to your forearm. So your wrist is just straight. You squeeze that, you can make a real strong, tight fist, and it's real stable and strong here. If you bend your wrist all the way down, try this for me, bend your wrist all the way down and then try to make a fist. And you'll be able to feel that you can't make anywhere near as strong or tight as of a fist with your wrist bent down as you can with your wrist straight. So if you go all the way down, try to move it, it doesn't get as strong. You can't get as good a contraction. It puts you at a mechanical disadvantage, and your hand can't function as good here as it can here. And that's the same type of idea with these positioning issues. If your shoulder blade is not in the right position, your thoracic spine is not in the right position, then you put your shoulder in mechanical disadvantage, and it can't work really the way that it's supposed to work. So, you know, if those are some of the more common issues that kind of get overlooked a lot of times by people, what does successful treatment actually look like? Well, it looks like hands-on therapy. You have to actually do something physically to change the way things are moving. If it's that postural issue, you might have to get in and release the pec muscle. It might have to mobilize the thoracic spine. You know, if it's that impingement positioning there, your shoulder blade's not working right, you might have to get in there and release one of the tight muscles under your shoulder blade, like your lats and your subscapularis are muscles that get really tight underneath your shoulder blade. And there's a lot of people that need a lot of work kind of actually in their armpit here to release that tightness so that then their shoulder can move more the way it's supposed to. And the most powerful technique for that hands-on stuff is trigger point needling, where we take a little tiny acupuncture needle and we find those spots and those muscles that aren't working right, stick the needle right into that little muscle there, and it actually resets your muscle and helps your muscle to function better. People always think that it's related to acupuncture because we use the same tool as acupuncturists use, which is the acupuncture needle, but there's no correlation to them whatsoever. This was started because physicians were doing trigger point injections. We've known for years and years that say you have a trigger point in your upper trap that can cause you a headache, or a trigger point in your rotator cuff can cause you pain down your arm, or a trigger point in your hip can cause you pain down your leg. And so they were injecting steroid for anti-inflammatory and like a pain numbing, like a lidocaine type of injection into those trigger points, and they were getting great results. And so then they decided to study it and figure out what was going on. And they assumed that when they got the medication into the muscle, it was changing the way the muscle was functioning. But what they found out was with EMG studies where they're checking the electrical activity in the muscle, as soon as they got the needle into the trigger point, the electrical activity in the muscle normalized. The muscle started to function the way it's supposed to. Because when we have postural issues, we have pain, we have tightness, restriction, it creates a lot of guarding and tension in our muscles, and they don't work right. They don't come on when they're supposed to come on. They don't turn off when they're supposed to turn off. Pain begets dysfunction in your muscles, and the more dysfunction you have in your muscles, the more pain it begets. And it just kind of is a vicious cycle that perpetuates itself. So they found as soon as they got the needle into the trigger point, before they ever injected any medicine into it, that the muscle normalized. And so then they started doing the trigger point needling, where they were just sticking the needle into the trigger point without doing the medicine, and were getting just as good of results as they were with the medicine. So since there's no medicine involved, then it transferred to physical therapists doing it instead of physicians doing it. And if you find the right trigger point that's affecting dysfunction in the way that it's moving, you can get incredible, tremendous results. And then corrective exercise, not just, okay, here's your list of generic, go grab a band and rotate out 20 times, but correcting what's going on. So it may be you need more pec stretching, or maybe you need a little bit more neck stretching, or maybe you need a little bit more stability training. The rotator cuff actually kicks in as a group and does its job to stabilize the shoulder when there's a lot more weight bearing on unstable surfaces. So if you're leaning onto those big Bosu balls, like a half ball, or leaning onto an exercise ball, the big, huge Swiss balls, and you're pushing through that weight bearing through it while there's this unstable surface, or having an unstable surface and trying to move your arm at the same time. These things that are actually a lot more challenging exercises for people, rather than just, because if you just, do a band out to the side and that's all you ever do, that doesn't necessarily always translate to different positions and different ways of movement. So actually trying to correct the problem with exercise and not just doing a really simple one plane of movement exercise is what makes the hugest difference for people. And then the class 4 laser that's listed there is a treatment technique that all of your professional sports teams are using nowadays. It's a powerful, powerful laser that actually gets deep into your tissue. And the laser light, again, you don't need to know these technical terms, but it's a laser light. It's called photobiomodulation. So photo is light, and bio is your system, your biology, and modulates something, changes something. So the light energy, when the photons get down into the cells in the muscle, the joint, the tendon, it actually changes the way your cells are responding. It activates the mitochondria, and it speeds up the process of healing. And so it's really a powerful tool to help promote the healing more so than any other modality would be. So, if you want to try to address the problem and not just try to ignore it or alter it, we can do a full movement analysis for you. We can have people come in and do a free 15-minute movement analysis and kind of see what looks like is the biggest problem, do a little 5-minute treatment to see if you can see a change in just a short little bit. And if you can see even a small change in a short little bit, you'll know that a bigger change is coming with more of that type of treatment. So we can do a free assessment for you. We'll just do like a 15-minute appointment and kind of do a movement analysis of you, what's going on with you, quickly see where we may need to work, and then do a quick little mini treatment to kind of see if it makes a difference for you, so that you can see what's happening with that, give you some advice about what's going on, what we think is happening with your shoulder, so that you can kind of start to try to address that now. We also can do any kind of addressing any questions that people might have about their individual situation. Let me go back to where I can see how many people are on here right now. So
see, there's 9 total participants, including me, including you and I.
Okay. So I was trying to maximize it so I could see everybody better. Anybody have any questions about their specific shoulder issues right now that I can address for you?
There wasn't much questions in the chat box, so hopefully other people will have some questions still to ask.
We can also do, there's another technique. I'm waiting for people to ask questions, but I don't want you to be just to sitting there listening to nothing. So if nobody has a question, another thing that we can do if somebody wants to give it a try, if you have a difference in like how one shoulder moves compared to the other shoulder and you have some pain with some movement, there's a treatment technique that we do that's rather uncommon as well called total motion release. And we can technically do it over the internet here. It's not, always quite as perfect over the internet as is in person, but obviously over the internet, I can't do the full movement analysis. I can't do the trigger point needling or the laser, any of those types of things that we do. But this technique called total motion release has tremendous results, and that's something that we could do, right now. So if there's anybody that wants to give that a try, you just unmute yourself and say something, and we can see if we can make a change in the way that you move and the way you feel right now.
Hey, Steve, this is David.
Yes, sir.
Hey, when I lift my arms, if I was to take it straight in front of me and lift it all the way up to the top, by the time I get to about a 60-degree angle, it's causing pain.
And is that just one side?
That's just on my left side.
Okay. Let me try to stop sharing my screen so I can make this a little bit bigger. Would you be okay with turning on your camera so that we can take a look at you and try to see if we can help you move any better over the internet here?
Yeah, let's see.
There you go.
All right. So when I take my arm going up, I get to about 60, and then I really can't go too much further beyond that.
Okay.
So.
Okay, and then when you do the other side, it's okay?
The other side, I can get full rotation around.
Okay. All right. Excellent. Can you pan back at all so I can see you sitting, like at least see your trunk when you're sitting there in the chair? Yeah, there you go. That looks good. So what we're going to do, we already know that there's a significant difference in the shoulder movement. So what I want you to do is give me a scale on that. So if we're comparing the two sides, and we're going to say your right side is normal and your left side is less than that, obviously. So if you couldn't move it at all, it was completely restricted, it'd be 100. If you can move it exactly the same as the right side, we call it 0. So we're kind of almost like looking for a percent difference. So if there's a mild difference between the two, we'd say, 20 or 30. If it's a moderate difference, you'd say like 40, 50, 60, severe difference, 70, 80, 90. So would you call it a mild, a moderate, or a severe difference?
I'd call it moderate.
Okay, so in that range of 40, 50, 60, what number would you give it in there?
I'd probably say about 50. I mean, okay. I can get it there, and that's where it stops.
Okay.
And I can't go any better back. Okay. I can reach the back belt loop, but there's a little bit of pain, but that's reaching around. So.
Okay, so we'll focus on seeing if we can get this movement better than a 60 with trying to do some stuff here. So let me have you sit on kind of the edge of your chair a little bit forward in the chair, just so you're not touching the back of the chair. And I want you to twist as far as you can twist to one side, and then come back to the middle and twist as far as you can twist to the other side. And tell me which side moves better. Which side do you move easier to? So twist as far as you can and then compare it to the other side.
It feels almost the same.
Okay. So if I were to tell you, you have to stay to one side for like 2 hours, which side would you pick? Which side's slightly better?
I'd pick my right side.
So turning towards your right is
turning towards better? My right. Yeah, slightly better.
Okay. So we're going to maybe come back and take a look at that here. But I want to look at your legs real quick first. So let me see if you can see my legs here. So I don't know if I can move back far enough, but you're going to try to have one leg straight and lift that leg up as high as you can. And then have the other leg straight and lift it up as high as you can. I want you to compare how well one leg lifts versus how well the other leg lifts.
They lift about the same.
Okay, so you don't feel any difference between the two?
No.
Okay. Then let's try, can you do a single leg sit to stand, like just balance on just one leg and stand up from your chair, and then try to balance on just one leg and stand up from your chair? Don't let that chair roll away from you and end up with a bigger injury.
No, yeah, they're both the same.
Okay. All right. So let's try that leg lift. I want you to try that leg lift with your leg turned all the way in. So try to twist your leg in and then raise it up, and twist your other leg in and then raise it up.
Just slightly better in my right side, but not much.
Okay. So we're going to start with the trunk twist because it's a really powerful motion, and we'll see if we can get any better on that left shoulder than a 60. So I want you to turn to your right side because you said that one was slightly better. And I want you to go as far as you possibly can, really push the end range, twist as far as you can twist in whatever way is most comfortable for you, and then come back and do it again. I want you to do 20 of them just to the right side. Go as far as you can, get a big stretch, but no pain at all. Does that feel okay?
Yeah, it's just fine.
Okay, so do 20 of those for me. Really pushing the end range, thinking about going as far as you can go, but in a comfortable way. And after we do 20 of them, we're going to take a short break, and then we're going to do 20 more, and we're going to reassess to see if shoulder's moving any differently. So this technique was created by a physical therapist in North Carolina 15 years ago or so. And it's kind of a reset of your nervous system, changes the way that your nerves are telling your muscles to move, kind of has one side teach the other side how to work better. We actually had studies all the way back into the late 1800s that showed that working the opposite side can improve the muscle function on the bad side. And nobody's really ever used it, and we just kind of ignored it. But this guy developed this technique where we work the good movements only and don't push into restriction, but we push into ease. And as we push into ease, it actually makes our body start moving better. And it's a really powerful tool. It's one of the only things I can do over the internet that makes a huge, huge difference for people. So is that 20?
That's 20.
Okay, so take a short break, whatever you need to. And I want you to try 20 more. We're gonna do 2 sets of 20, and then we'll retest your arm to see if there's any difference in it. So do another round of 20 when you're ready, and go as far as you can. Make sure that you're doing it in the most comfortable way. Your arms can be anywhere you want them to be. There's no particular posture. If it feels better to slouch or sit up more, whatever feels best to you. Twist as far as you can go in the most comfortable way possible. Do 20 more of them, and then we'll retest.
Steve, while we're waiting too, someone did comment in the box here. I think it was the gentleman that we talked to when we first got on. He was talking about having surgery in both shoulders, but after each, he said his overhead strength in each shoulder has just remained weaker, and then he doesn't have the flexibility reaching behind his back. And then the other thing is he gets some cramping in his biceps sometimes when he reaches behind the back. So that was just a comment he dropped in the box a minute ago. So
that's a common situation that happens when people just get kind of the routine, mundane, traditional, therapy exercises. Okay, just, kind of slide your arm up the wall and do these band exercises. It helps a lot to get that initial gains going a lot of times, but you don't get the end function that you need. We'll come back to that in just a second, since it looks like David's done with that. Now, let's try, David, doing the left arm raise as far as you can overhead and just see if it's any different than it was before. So that's a whole lot higher than it was before. What does that feel like?
Yeah, it is.
So if we had to give it a score, if it was a 60 before, what would it be now?
I think we got about 40. It stops right at the top, but.
So that's good though, 20% improvement with doing that motion right there. So what do you think the first rule of this technique should be? If something works, we ought to do it again, right? So that's what we're going to do. Since that helped, why don't we try it again? So why don't you do 2 more sets of 20, just like you did, pushing that end range to the good side only on those trunk twists. And I'll talk a little bit about what that question was referring to about post-surgical stuff while you do that. So do 2 more sets of 20 to your good side, twisting there, and then we'll retest it again. Make sure you're pushing as far as you can possibly go, going to end range in the most comfortable way. Your head and neck and arms can be anywhere they want. Your legs can be anywhere they want. Just do what feels good to you. Twist, twist, twist. Yeah, so with the question about the surgery, you know, that's the problem that happens a lot of times when you don't get aggressive enough and full-fledged enough, full corrective exercises and full manual treatment. So, you know, we can get about 80% improvement with kind of generic, general stuff a lot of times after rotator cuff surgery. But a lot of times get that very, very last little bit, get that full end range overhead or full end range behind the back, or that, you know, strength to be able to lift things overhead or to do something a little bit faster or a little bit more athletic. It takes challenging those muscles a little bit more. So just doing the general generic, you know, rotation of the band exercises or something like that is a great start, but it needs to be extrapolated and added upon with more challenging things that we do with balls and body weight and different types of stability training and scapular training and thoracic training and all that kind of stuff. So it's very common that you could still make significant progress no matter how far out you are from surgery if you're still feeling some weakness and some limitation at end ranges. There's no reason, if, you know, surgery was able to fix it completely, unless, you know, if your surgeon says, well, we couldn't repair it all the way, there's still a significant damage in there, then maybe you'll be left with some limitation. But if they were able to repair it all the way, it's just a matter of the rehab wasn't extensive enough to get it to full function again.
Okay.
How you feeling, David?
Feeling good.
Getting tired of doing some twists?
I need to dance more, apparently.
Well, you're going to be a great chair dancer if you keep doing this.
Yeah, it's just that continuation. I need to do that while I'm on enough of my conference calls.
All done?
Yeah, much better, much further than I could before.
Good.
Okay.
So that's, you know, one thing that you can work on. You can work on those trunk twists to the good side. We have lots of variations with that technique to try to extend it further. Maybe working the leg, maybe working the other shoulder. But, you know, for right now, that's something you can do on your own to help it move better. And then if you wanted to get in here and have us do some more treatment on it to get more lasting effects and more long-term full solution of, you know, whatever's going on there. But that technique is really powerful. You can see, I don't know if the rest of you could see David's camera very good, but there was a tremendous difference. He was barely to shoulder height, and then he did like a full circle after doing basically four sets of trunk twists. So it tells you there's a lot more going on in the body than just the shoulder joint. It's not just about what we want to make it about. We want to make it about, okay, that arthritis, that rotator cuff tear, that labral problem, that tendonitis, that bursitis, but the whole body is involved in it. And that's one of the reasons why we call ourselves core rehabilitation, because we have to focus on everything, not just one particular spot. And so that would be something we can progress upon there, but that's at least something you can start doing now to help you feel better right off the bat. Any other questions from anybody?
What about insurance coverage? Do you guys take most insurances, or is this outside of insurance?
No, we take pretty much all insurances. There's a couple that they didn't let us on, being a small little private practice, but 90+% of insurances we take and we're in network with. And so, you know, whatever your insurance benefits are, you know, I can't tell you until they check your particular benefits. Some people it's 100% coverage, some people it's 20% co-insurance, some people it's $20 copay. It's different for everybody, but yeah, we take pretty much all insurances.
Okay, because I went through 12 weeks of rehab after my surgery up in Ohio. That's where I had it, but I haven't been to rehab since probably January. And you're right, everything was mostly bands and balls and things like that. And I progressed really quickly. I was about 7 weeks ahead of schedule because they don't really challenge you the way that you need to be. So I started working out in the gym, doing my own stuff. But still, I don't have that strength that I had before, which I was talking about overhead and behind the back. And you know, I can push hard and I can pull hard, but I can't go out for my, you know, the
Yeah,
strength.
it comes out to the side.
Yeah, it's just not where it was.
Yeah.
So,
yeah, that can definitely change still. There's still plenty of opportunity to retrain those muscles, build up more control, more endurance in there so that you can get back to functioning better than you are now.
yeah, I want to get back to playing golf. I haven't swung a golf club in, you know, since that August of 2018 surgery. So that's really my goal, is to get back to doing that.
Yeah. Yeah, we can definitely get you back there.
Yeah, I'll make an appointment and come in there.
Okay. Yeah, we'd be happy to help you out.
Okay.
Excellent. Anything else from anybody? I don't want to keep you guys on too long. Our goal is usually about 40, 45 minutes. We're about 41 minutes now, but we'd be happy to answer any other questions anybody might have. You can always call and schedule a little free screen with one of our doctors here if you'd like to, or you can ask any question you have right now in the next couple minutes. Okay. Well, feel free to contact us anytime you want. We'll get off here and let you get back to your day. But thank you for joining us. Hope you learned something, and hope that help you in some way. And we'd be happy to help you some more. You guys have a great day. Hope everybody survived the snowmageddon okay, and not too many leaks or anything in your house.
Yeah, I left Ohio. I left Ohio to get away from this stuff, and I come down here and I'm like, my God, you know.
It's your fault it followed you here.
I guess. But yeah, we're all good.
All right. You guys take care.
Thank you.
Thank you.
Thank you all for getting on.